Good morning. So glad that you were tuned in this morning, and I hope that you'll have a chance to really keep with us the full hour because we're talking about COVID-19 and the vaccines, plural, that go along with it, with a very special guest this morning. The Interim Health Officer at the Hamilton County Health Department, Dr. Fernando Urrego, has been gracious enough to welcome us in. And I mentioned the full hour because he has kind of cleared his calendar for us. And so the conversation you're about to hear is going to be unedited. We'll break it up for commercials, but this is not going to be a 2 or 3 minute snippet to try to encapsulate a lot of information in a brief span of time. We're going to have 30 minutes or more to talk with him this morning, so get your pen and paper ready, text a friend and say watch. So Dr. Urrego, thank you so much for your time.
Thank you so much. Thank you so much for
I
the invitation.
wanted this much time with you because the intent, I think, for both of us is to teach people, educate people, but to talk to everybody watching this morning, those who are vaccinated and have questions about their status, those who are unvaccinated and feel a little bit like maybe they're being pushed in a direction and they're not quite sure why. We're wanting to address everything fairly. True?
Sure. I think that's fair.
So we're going to try
that's important.
We're going to try to rapidly go through some of these questions because I have a lot. So let's start with the simple numbers and the facts. Percentage in Hamilton County of people who've been vaccinated. Where do we stand?
So people who have been partially vaccinated were about 50%.
Okay.
And people that are fully vaccinated were 44%.
How do you feel about those numbers?
I think those numbers can be higher and should be higher, and we should aim for higher percentages in order to protect the community.
What is your goal in terms of a percentage of vaccinated population?
So there are a lot of numbers out there. 70% is the number that everybody wants to reach. But ideally, if we reach 80%, we would be even better.
When you are looking at these numbers, are you taking into account, and when I say you can tell me if this is a collective you and other medical professionals in the county, or if it is strictly through the health department. Do you take into account those who have had COVID and therefore have some natural immunity?
So, and I'll speak for the collective we,
Okay.
the physicians in the community that I talk to. We do feel that when we say 70% or 80% includes anybody who's either been exposed and has had the natural infection or somebody who's had the vaccine.
Okay,
So that number includes the whole group.
Because, you know, people are watching you this morning and they're also on their phones reading all different news sources and social media. Something that's been out there a bit of late is the question, is there a difference in being unvaccinated and being non-immune?
Yeah, so it really depends how that question is framed. But if we say, is the vaccinated person compared to somebody who's not, do they have the same protection? Is their protection the same if they were to get infected again? And what we know is that if you get vaccinated, the protection that you get from the vaccine is significantly better than the protection that you would get if you get the infection.
So you're saying that the protection from the vaccine trumps the natural immunity?
That's what the data would suggest. So
and is that showing that as an immediate benefit or over time?
it's hard to say what happens over time because we know whether you've had the infection or whether you've had the vaccine, your protection wanes over time. So the antibodies that our bodies make eventually start to go down, whether you've been vaccinated or whether you've had the infection. So that's hard to know for sure. But long term, what we know is at least with the vaccine, we could say that the antibodies start to wean at around 8 months. So your protection starts to go down.
After 8 months with the vaccine?
After about 8 months with the vaccine. I don't think we have the data of whether you've just had the infection, but it's probably less.
Probably less.
Less time.
So if you were to be conservative in your approach, and let's say you're someone who got COVID naturally in May of this year, just for kicks, and you think, I'm going to go ahead then and get the vaccine. One, should you have your antibodies tested before you get the vaccine?
So the answer to that question is easy. The antibody test doesn't really help us much. There's no data that we could sort of look at and say, well, if your antibody level is X versus Y, then you're protected, right? So the antibody test is not recommended to assess whether you have appropriate immunity or not.
Okay, if you then go ahead and take the conservative approach, and 2 or 3 months after having COVID, you get the vaccine, and then you are exposed to someone who has had COVID, is your body going to now pull out the immunity you have, the protection you have from having had COVID or from receiving the vaccine? Do you understand my question?
Yes, that's a good question. Our immune system is amazing how it works, but our immune system doesn't differentiate the exposure of a natural infection to the virus or an exposure to the vaccine. So it's not necessarily going to do the math and say, well, I mounted a response because I've had the natural infection, or I mounted an appropriate response with the vaccine, and now I've been exposed again. Which one am I going to use? Mm-hmm. The body makes antibodies regardless of what the exposure was. Does that make sense?
Yes, it makes sense. And I'm not a medical person, so that's why I feel so free to ask you these questions.
Yeah, sure.
So you mentioned the antibody word again, yet you were quick to say a minute ago that the antibody level is not really an indicator of whether or not you're protected.
Right.
So I'm not understanding that.
Yeah. So the statement about the antibodies, the antibody test, so the blood work that a lot of people are saying, well, I'm trying to think whether I want to get the vaccine or not, and I've had the infection, so hence I must have enough antibodies. A lot of people are going to get the blood test. Unfortunately, sometimes you could have great protection and the antibodies are low, or you can have low protection and the antibodies are coming back high. Okay. So the antibody level that you have from that blood test is not a very good marker of protection, not only because you're only measuring the antibodies, there are a lot of other parts of the immune system that we are not checking. So we're not checking our T cells, and T cells have a big part in how our immune system remembers an exposure, right? So that lab work that somebody's going to get to see whether they want to get the vaccine or not after having the infection is going to miss part of the picture. That's why it's not recommended.
Delta variant.
Yeah.
When people are coming in and they're getting tested for COVID and they're coming back with a positive result, how are you testing for the Delta variant versus the traditional?
So most of the tests that are out there that people get, whether you're getting the PCR test, the antigen test, or the antibody test, all these tests only test for the SARS-CoV-2. So it tests for the virus, right? It does not test for the variant specifically. So if I have a test, whether it's a PCR, whether it's an antigen test, it only tells me I've been exposed to SARS-CoV-2, which is the virus that causes COVID-19. It doesn't, however, differentiate between Delta, Gamma, or any of the other ones. To get that information, you need a test called gene sequencing, which is not done in your home test kit, right? Okay. These are tests that are done in special labs, and most of them are done at the state lab.
So if someone, we had COVID in my house a year ago.
Yeah.
So we went down to the Alstom plant and got our little test, and it came back positive, and we were then in contact with someone from the state health department who would call us daily to see how we were doing. They were looking at our results.
Right.
But you're saying if it was now and we did an at-home kit, there's no way to trace that.
Right, and even the one that you probably got when our health department called you, it was really only either the PCR or the antigen or the antibody for the SARS-CoV-2, not the variant specifically.
Okay, we're going to stop for a second and take a quick commercial break. When we come back, we'll continue to touch on Delta, especially in its relation to our kids. That's on everyone's mind. We're back with more with Dr. Fernando Urrego at the Hamilton County Health Department. Stay tuned.
My grandfather taught me that a good name is more valuable